Great. Okay. So welcome to everybody who is tuned in today. So we are the Africa Harm Reduction Alliance, or AHRA, and we are a platform that represents preventing disease and saving lives through harm reduction. So my name is Jess, and I'm your host for our session today. So in AHRA, it's our mission to reduce drug, alcohol, and tobacco-related death and disease in Africa by educating policymakers on the benefits of harm reduction policies. AHRA also brings together leading harm reduction experts in the medical, health, and policy communities. We also like to shine a light on prominent women in tobacco harm reduction, which is why we are here today, to highlight the talented women in the THR space who work tirelessly to progress our cause to saving lives. Today, we are shining a light on our special guest, the lovely Asanda Gcoyi of South Africa. So Asanda is the CEO of VPASA, the Vapour Products Association of South Africa, which is a position that she has held for the last 3 years. We are here to learn more about you, Asanda, and your journey to being the CEO of VPASA. And we would love to know more about what VPASA does and how the organization can help consumers to navigate the maze of the vaping industry. If anybody has any questions to ask in the session, please do so in the comment section in the chat, and we will do our best to answer them today. So over to you, Asanda, to introduce yourself.
Thank you, Jessica. Hi, everyone. As Jessica said, the name is Asanda Gcoyi, and I am currently with the Vapour Products Association of South Africa. An important element about myself is I'm a mother of 2 girls. I am a wife, and I am what people call a lover of life. So in a nutshell, that describes who I am. The Vapour Products Association is an industry body in South Africa that represents the value chain in the area of electronic vapor products. So we represent some manufacturers, importers, retailers, and the like. And I think that the important thing about the association is that when you're operating in a legislative vacuum like we are in South Africa, we are there to plug in as an industry body to ensure that together with government and various stakeholders, we would be in a good position to come up with the right kind of regulations for the industry. So that's in a nutshell what the association is about, Jessica.
Thank you very much for being so clear. So we know that there are concerns in the industry around youth and premature access to vaping products. How does VPASA approach the issue of youth access prevention?
I think what's important to note from the onset, Jessica, is that legislation plays a very important role in limiting access to products. So in the absence of that, here in South Africa, the association has taken a proactive approach where we've self-regulated. So from the code of conduct that the members sign when they join, we are quite clear on certain behaviors that we will not accept as an industry. And one of those behaviors is the access of our products to young people. So over and above the code of conduct that the members have signed, last year, we launched a youth access prevention campaign, which was meant to solidify that position we've taken on the code of conduct to say, let's take it a step further and actually make it, yes, it's about VPASA members, but how can we extend it so that even people or companies that are not part of VPASA can start to think about the importance of limiting these products to young people. So in drawing up those guidelines, there are a couple of key elements that we looked at. So we looked at the issue of marketing, where we said we are not going to directly market our products to persons under the age of 18. We've also said that VPASA members must ensure that they take all reasonable precautions and do due diligence in ensuring that they do not sell to these minors. We've also looked at sales. So sales has 2 elements. You've got the online sales as well as the face-to-face. So in face-to-face sales, in the guidelines, we've said in the shops, our members need to ensure that they've got no under 18 will buy our products displayed visibly in the stores, so that when a person comes in and they look like they're under 18, you may ask for their ID. So they won't be surprised, because it will be posted, you know, all around the store. People buy online as well. So the importance of having age gates and age verification systems on their website. And then we looked at, so over and above the buying face-to-face and online, there's the element of delivery. So how can we partner with delivery companies to ensure that they do not deliver the products to young people? So the onus is on the actual members to speak to their courier companies to say, you don't let someone who is under the age of 18 sign for these products. And then a last element that we emphasize is the importance of staff training. Because if staff does not know what's expected of them, I mean, they will miss all of this, where they would sell to people who are under the age of 18. So we've really been proactive in trying to do our best to ensure that we don't get young people hooked unnecessarily. And from a VPASA point as well, we've then added an extra element of mystery shopper. So randomly, we will select from our members where we will send out. We've got a company that we work with, and they will pretend to buy and all sorts of things. And we get the reports on how our members are doing in this regard. So it's quite an extensive program that we've put together just to ensure that we protect our young people.
It's really impressive to see how proactive and engaged VPASA have been to ensure that youth access is limited. And it's such a complex picture, and it's a very holistic effort. So it's really promising to see what VPASA has done, and really VPASA is a good role model for other up-and-coming organisations if they want to do a similar kind of thing to create that impact. So that's really promising to see. So I congratulate VPASA on doing such a great job with that. Okay, so I have another question for you. It's regarding something that is on the VPASA website. So VPASA mentions on its website that it seeks to contribute to the growing body of empirical evidence that the products represent a safer alternative to smoking and have the potential to save millions of lives. Can you provide any examples at all of this empirical evidence that VPASA has been either directly or indirectly involved with, and how this can or will contribute to saving lives?
That's a very important area for us, Jessica. And I think a lot more can be done where we are concerned. To date, as an association, we've led 2 studies. One was an assessment of the vaping industry. So this was done, I think, at around 2017. And that came as a result of, I mean, when there are regulations that are going to be imposed on the industry, and you don't have a clear picture of what the landscape looks like, you sort of working in the dark, and it really doesn't help to inform you on what could work and what would not work. So that was the one. And then last year, we also did an economic impact assessment of the industry. And that was important on 2 fronts. In 2020, the industry was banned when there was lockdown during COVID. And that had a huge impact because we couldn't trade for about 5 months. So with the impending bill that's currently with the Department of Health, and now with excise being proposed for the industry, it's important to understand what the landscape looks like. But not only that, but what has been the contribution of the industry, because that gives you a good roadmap to be able to predict what could the industry contribute towards. I mean, South Africa is in serious trouble when it comes to job creation, for example. So those are 2 key studies that we've led as an industry body. However, the biggest missing pieces where scientific data is concerned in South Africa is we do not have locally produced scientific evidence. And that has been a serious bone of contention, because when you look at the original proposal by the Department of Health, they spoke about driving. So they would drive the research component of finding out the efficacy of ENDS, for example. They were going to lead studies that would look at the cost-benefit analysis, what impact vaping has, etc. So we relied on that component where the department was concerned. Unfortunately, 4 years down the line, that research is not forthcoming. So we need to plug in the gap. And I think that's why we've now taken a decision to say we need to look at, for example, the issue of youth vaping in the country. We need to look at vaping and smoking prevalence in South Africa. And we also need to look at the socio-economic impact of the bill for the vaping industry. So we've got a couple of those studies that we are starting to look into, with the view of having something by the end of this year, because we believe that would really help in further conversations with the authorities on regulating the industry.
Again, that's a very good example of a proactive approach that VPASA is taking to try and fill those data gaps this year. So in terms of finding those assessments, if our audience wanted to go and find the outcomes of those assessments, those reports, where could they go to find them?
They could visit our website. We've got a link there. They're listed, and then we get the email and we send them through to them. Our website is www.vpsa.org.za. I hope.
I'll post a link down the bottom below the video. Yes, so I can help find it. Yeah, we'll do that.
Okay.
So I've got another question for you. So there was some very good news recently for South Africa. So the South African Bureau of Standards has announced that it recently established a national technical committee to develop South African national standards to guide the use of vaping products. Can you please tell us a bit more about this particularly, and why this is an important step for the industry in South Africa?
Again, it goes back to our legislative vacuum. We initiated this process actually as far back as March of last year. So we approached the South African Bureau of Standards and asked if they could work with us. We desperately need standards. And that's recognizing that without the guidelines of legislation, we really cannot continue operating the way we are operating. One, we need to protect consumers. So consumers need to have peace of mind that the products that they are using are safe and the quality can be guaranteed. But not only that, the moment you have standards in place, you give an opportunity to the industry to grow as well, because it's a step further to professionalizing the industry. So we're very happy that there's finally movement on that. And I think what we have promised from the onset, we've promised to government, we're promising to the South African Bureau of Standards, it's cooperation, because we really do believe that when we have the standards in place, it will help put the consumers' minds at ease, and it will really you can start seeing that the rogue elements will start coming out, and that we do away with illicit and all of that stuff. So there's a lot of prevention that we are trying to do with the standards, and we're very, very excited that that process has started.
Well, congratulations, because you mentioned that's been a year, if not over a year, to get that. So can you just give us an idea, top line, of how you've managed to get that started? Because it's obviously been a long process, so that our audience can understand, what do you need to go through as an organization to bring about change, significant change, which I would say that's a significant step. So what does that process look like, and how does that engagement look like with government and stakeholders? Yes.
I think what the audience must know as well is that we've always looked up to the UK. I mean, the UK has done incredible work in this area. be it from a legislative point of view or excise. So it's all encompassing. So for us, the UK represents the golden standard when it comes to tobacco harm reduction. So we seek to emulate, you know, to what you guys have achieved thus far. So in initiating that conversation for us, we recognize that sometimes you don't need to recreate things. You know, the BSI standards are world class. I mean, they speak to global good practice. So that was our first port of call. We looked at the BSI standards and said, in an ideal world, these are the kinds of standards that we can see governing the South African industry. So when we entered and when we went to the SABS, that was our initial ask, to say, we don't want to start the process from scratch where we start with definitions and all of that stuff. We can adapt these standards and then localize when the time does come. So the tricky part and why it took so long was, because there's no regulation and there's a current bill in the pipeline, SABS was reluctant to take the lead on this process because they believed it would be better served if it was done by the Department of Health as the custodians of the current bill. But then with back and forth and health, not forth, Department of Health, not forthcoming in terms of willingness to assist in this process, we really pushed, because we said whether health comes on board or not, we have to have these standards. We cannot wait for the bill, which has taken almost 4 years to move. It may take another 4 years, and we don't have another 4 years to say to consumers, wait until we sort out the bill, you know? So we put that pressure to say, let's work with the people who want to work with us. And let's find individuals, organizations that have the same interest as we do. And luckily for us, I mean, they saw the logic, it makes sense. And I guess also with the growth of the industry, they realized that the more the industry grows, the higher the risk, you know, in terms of the market being so open that any Tom, Dick, and Harry can come in. And unless we start with the standards, we may run into trouble. So that has been the journey. It hasn't been easy, and we don't think it will be easy going forward. But I think what we do have is the willingness to make it work, which I think is the most important thing at this point.
Sure. Yeah, it's a really nice example again of VPASA taking a very proactive and pragmatic approach to something that needs to happen, and recognizing that and learning of other nations rather than just reinventing the wheel. You've taken those learnings and you're adapting them and localizing them, and doing that in a pragmatic way. So again, very, very interesting to hear that story and that journey. So one last question for you. So are there any significant events or consultations coming up in South Africa that we could be aware of or need to be aware of this year?
Sure. Yes, a big one for us is it's the excise. We had the discussion document that was shared by the National Treasury in December. We made inputs, and as of last month, we actually had our first engagement with the department. And for information for those who don't know, the National Treasury of South Africa wants to impose an excise to be effective as early as the 1st of January next year. And obviously there are many problems with not just the timing, but also the discussion document, etc. So we made secondary inputs on the 22nd of April. And what we're waiting for now is a revised policy document from them. We're hoping that it takes into account the serious concerns by the industry. And so from June, July, that's when we're expecting the draft bill will be presented, and there'll be public consultations, which we will take part in quite extensively. But it's a big one for the industry. I mean, it's not only premature in our view, but some of the frameworks and proposals just do not make sense for our environment. So we're trying to push that process, rather waits for the bill to come into play, and then we can start looking at imposing excise.
So it's a big year for the industry this year and for VPASA as well.
It
So
is.
perhaps we have a follow-up session after that to discuss how that's gone.
That would be great.
That would be really great. Yeah. Thank you. So we're going to wrap up the session. Is there anything last minute you'd like to say, Asanda, from you at all?
No, not really. But I think when we, like, I think you alluded to this point, when we look at what other nations are doing, it really is important, and not just for us as an industry, but that's what we're urging our government to do as well, where you really need to look at what other nations have done, especially the ones that seem to be getting it right, because there's always learnings to be had. So we're really pushing that the South African government will look to Europe, UK specifically, on how to tackle this issue of smoking prevalence, and really make sure that we get as many people off tobacco as possible. That's been our call, and we will continue driving that message.
Sure. We do actually have a question from Kurt in the audience. You may have answered it, but he says, how do you impose an excise without regulations and standards in place?
Mm-hmm. Yeah, that's our question, and I mean, when we ask this question to the National Treasury, the response they give, and when you look at processes, that the two things don't need each other. So you can propose an excise in the absence of a regulatory framework. But in this particular case, even if there's no regulatory framework, you still need consensus of some sort, be it a strategic plan document, whatever it is, but there needs to be consensus, especially if you're saying the very reason why you're imposing the tax is for health considerations. So we all need to agree that the health considerations make sense and they are correct. And in this case, unfortunately, the health considerations are disputed by the industry and other health professionals. So that's why we feel they're jumping the gun at this point. And we continue to engage with them and really try and help them see things the way we see them, so that ultimately we'll come up with regulations that work, for South Africa.
I think the problem is there's lots of misinformation out there, and there's lots of confusion around the health effects of these products. So one major obstacle that we've got is how do we correct this misinformation so that people are well informed of the data, hence the need for studies in different areas. So thank you so much for a very thorough and well thought out answer. Hope that answers all the questions that we have. So should we wrap up the session?
Yeah, I'm happy to.
Well, thank you so much, Asanda, for your time. Really enjoyed your company. And we'd love to have you on again later on in the year, potentially after the major consultations that you mentioned. If there's anything particularly interesting that anybody found in the audience that Asanda spoke about and you would like to know more of, then do put a comment below the video in YouTube and on our social media platforms, and we'll do our best to answer those potentially in a follow-up webinar or in the comment section of the video. So please do stay tuned on our website, ahra.info, in the news section and the events section, and our social media channel, which is Twitter, which we use, to learn about our next coffee chat, where we'll be meeting our next expert in the harm reduction space. So do stay tuned, and thank you everybody for joining, and thank you so much, Asanda, again, and have a good day.
Thank you for having me.
Okay, see you soon.
Okay,
bye.
bye-bye.